When most people picture medical billing, they imagine a windowless room where clerks punch codes into a terminal all day. The focus is entirely on volume, cranking through a massive stack of claims with zero mandate to actually solve the underlying problems. This static model creates a trap for the professionals doing the work. You hit a ceiling fast, your skills stagnate, and you become completely disconnected from the actual business of delivering healthcare. But that static view completely fails to capture the current reality of the industry. Right now, home health and senior living facilities are scaling up rapidly across the country to meet massive demographic demands. This chart shows what happens when you force all that new claim volume from expanding facilities into a narrow, outdated revenue processing pipeline. The operational growth outpaces the financial infrastructure, creating a severe bottleneck we call the financial vacuum. Standard data entry bots and automated clearinghouses cannot fix this. They simply reject anomalies and kick them back into the queue. Clearing this gridlock requires proactive human problem solvers who can investigate why a transaction failed in the first place. Modern healthcare is navigating a dynamic revenue processing crisis, and clearing that bottleneck requires a new kind of operational engine. That engine is being built at True North LLC. They have designed a fast-rowing, progressive environment specifically to tackle these complex operational bottlenecks head-on. The RCM Accounts Receivable Specialist anchors this environment. This role operates as an operational architect, investigating billing discrepancies, tracking down short payments, diagnosing failed transactions at the root. To execute this, specialists rely on a specific analytical toolset. They navigate complex ERPs and accounting systems like QuickBooks and Dynamics GP, and they use advanced Excel techniques to parse through massive datasets. The expectation is proactive analysis. They track billing trends to identify recurring errors, allowing them to recommend specific workflow improvements and new automation strategies. The true value of a True North AR specialist lies in their ability to permanently fix broken financial systems, rather than temporarily correcting isolated transaction errors. This internal data work directly supports physical operations across the country. The specialists work in direct partnership with Brightstar franchise owners nationwide, managing their revenue cycles. This diagram illustrates denial management. Resolving a complex payer reconciliation issue reverses a blocked transaction, injecting trapped operating capital back into a franchise's budget. That recovered capital is immediately converted into funded payroll and patient care resources across a geographic map. To make this happen, the specialist collaborates tightly with client success managers. Together, they ensure that every billing resolution plan perfectly aligns with the operational standards and expectations of that specific franchise. Behind every thriving, expanding healthcare facility is a meticulously managed revenue cycle that keeps the payroll funded and the resources available for care. Managing stakes this high dictates a highly collaborative internal culture at True North. The sheer complexity of the revenue cycle means team members genuinely rely on one another to succeed. True North's leadership actively seeks out specialist feedback. The data-driven insights gathered by the AR team are used to make global operational decisions and improve processes company-wide. Because the company is constantly optimizing, there is a direct correlation between taking initiative and unlocking targeted professional growth. This matrix charts the concrete career advancement pathways available. Successfully resolving specific workflow bottlenecks creates branching pathways that allow specialists to step up into operations leadership, complex finance, or dedicated client success roles. The ideal candidate for this environment fits a specific profile. They are highly analytical, entirely solutions-focused, and completely comfortable navigating fast-paced remote collaboration tools like Zoom and Google Meet. For ambitious professionals looking to escape stagnant administrative roles and actually drive operational excellence, the opportunity is ready and waiting. At True North, solving complex healthcare challenges isn't just the job, it is the process by which you move from processing transactions to engineering the system